Welcome to All Access, where we meet at the intersection of healthcare and generic and biosimilar medications. Brought to you by the Association for Accessible Medicines, representing the generics and biosimilars industry. Hello and welcome to All Access. I'm your host, Dan Leonard. Every 3 minutes, a child is born with cleft lip or cleft palate. And without treatment, this can cause severe health problems for the child and even death. It is not uncommon for babies with cleft to have so much difficulty feeding that they will die of malnutrition or starvation. But there is hope. There's an organization that we know well that for the last 40 years has provided free cleft surgery to countless children around the globe. And I'm speaking of Operation Smile. This is one of the largest volunteer surgical nonprofits in the world. And as you will learn today about Operation Smile, the team does far more than just change a child's smile. It truly transforms their life. Operation Smile is part of the AAM family, and we're very proud of that. And we're honored to have Operation Smile as an associate member. And I'm very pleased to welcome our guest today, Kendra Davenport. Kendra is the Chief Development Officer for Operation Smile. Kendra, welcome to All Access.
Thanks, Dan. Thanks for having me. Happy to be here.
On our podcast, we'd love to learn more about the individual and then the organization. So we'd like to start with you, Kendra, and just a little bit about where you're coming from, the work that you do, a little bit about your background, where you grew up.
Thanks, Dan. Really happy to be with you today. So thank you. Thanks for having me. Thanks for the time. We're very delighted. We are a member of AAM, and we love talking about it. So I started my career in nonprofits 33 years ago, I guess, 33 years ago. And I must be a masochist because I've stayed in development fundraising that entire time. And I fell into it by happenstance, but found I was good at it and I really enjoyed it. And I've had the distinct pleasure of working for a number of nonprofits throughout my career whose missions I was able to really passionately champion, and Operation Smile is first and foremost among them. I mean, I'm here now, but the mission speaks for itself and our work is truly transformative. What makes it even more special is that it's done by a core of more than 6,000 volunteers from all over the world, so that surgery is always free. Most children, when they're born with cleft, require more than one surgery, and we're in it for the long haul. We provide the initial surgery, the secondary, the third, the fourth, the fifth surgery, whatever's required. We're there for that child and their family. And we provide what we call wraparound services as well. So psychosocial support, dental support, nutrition, you name it, speech therapy. We have, again, a core of volunteers that's skilled in all of those things. So when a child is identified and they come to us and they're assessed, we are able to start at the beginning and take them through their journey to repair the cleft palate, give them speech therapy, and ensure that they lead healthier lives. And it's really remarkable to see them and their personalities emerge, once they receive that surgery.
So, cleft is obviously something that impacts children all around the world, but tell us more about the condition, the prevalence around the world, and are there particular regions of the world where it is more prevalent?
Yeah, there are pockets in the world where cleft is more prevalent, but it's universal. We see it in every country, everywhere. And as you said at the top of the podcast, every 3 minutes, a child somewhere is born with a cleft lip or palate or both. In the United States, I remember when I took the job with Operation Smile, my dad said, I see their program on TV, Kendra, but I never see a child with a cleft lip here in the United States. Do Americans not have it? No, Dad, we have it, but we have access. Most Americans have access to some of the best care in the world. And we treat cleft very, very early in the United States because most of the time it's identified in utero on an ultrasound. So families are prepared, doctors are prepared to treat it immediately after that child is born within, a few days or a few weeks. But in other parts of the world, access to healthcare, which is a tenet we're really bringing to the forefront of our work. We are first and foremost about cleft surgery, cleft lip and palate repair, and we always will be. But as the organization has grown, we recognize that one of the biggest barriers to care is lack of access to healthcare centers, lack of access to doctors who are trained in cleft surgery. So Operation Smile for years has trained surgeons in countries around the world. And just about every surgical program we do incorporates some training. So for example, the surgical program I went on in June of this year was in Guatemala City, and we had 3 American surgeons. And it was, again, one of the first international surgical programs we'd done in a while, where we were actually flying people from one country to another because of COVID and the restrictions. But we had 3 American surgeons and 2 young Guatemalan surgeons. And in every surgery, one of those American surgeons or more was guiding and mentoring the Guatemalan surgeons on how best to repair a cleft lip. So we try very hard to make countries more sustainable, make their healthcare systems more sustainable, so that when we're not there, there are docs and nurses and anesthetists and postoperative medical personnel who can provide the same kind of treatment that Operation Smile strives to provide when we do a surgical program. What causes cleft? We don't know for sure, but Operation Smile conducts research, and we have the largest repository of cleft lip and palate data from people around the world, from patients around the world. And we have fellows working, surgical fellows and researchers working to identify what the primary causes are. We do know that, we think it's hereditary. Some doctors think it's hereditary, some researchers. We do know that external influences like the inhalation of cook smoke in different environments can make a baby more susceptible to being born with the cleft. So we haven't cracked the code on that yet, but we're working on it.
Well, you mentioned in that those comments, access, and that these children don't have the access, and we maybe take it for granted in this country. You're on the right podcast, because we are All Access. It's our middle name of our organization. And in our case, it's making sure that patients have access to medications that they need. Mm-hmm. In your case, it's making sure that children around the world have access to the surgeries that they need. So it's a great alignment here. I feel it coming. Tell us a little bit about it.
There's a reason we're a member.
Tell us a little bit about that.
Our GIK, our Gift in Kind program, is absolutely essential to the provision of free surgery. Everything from the sevoflurane to the drugs we administer, before and after surgery, to the gloves we use, to the sutures, is all donated. And what isn't is purchased, but we strive very hard to get the bulk of it donated. That's getting harder and harder to do, mainly because of shipping, not because the product isn't available, not because your members aren't generous. They are very generous, and many of them are donors to Operation Smile, and many more of them we've signed MOUs with, and we're in embryonic discussions. So that nothing pleases us more. And to anyone who is listening who has an interest, we are always interested in talking to new GIK partners. Pharmaceutical companies have been at the heart of our work in terms of the support they provide since the inception of Operation Smile 4 years ago. And they will be, I think, going forward on infinitum. We try very hard to source more and more product, consumables, disposables, drugs in country, to avoid and get around shipping if we don't have to, because it just adds time. It just adds a lot of time and a lot of expense. And in many countries, there's the VAT to worry about as well. So increasingly, our GIK partners, all of whom are pharmaceutical companies or medical instrument manufacturers, work with us in country. And I think it's a very healthy, most of those relationships are super healthy because they're symbiotic. They're mutually beneficial. We work in 35 countries right now, and many of those are home to emerging markets for some of our pharmaceutical partners. And so we're a great organization to align with. We have deep connections to the communities that we work within, to the governments. So it usually makes for a very nice and strong alliance. In another few months, I think in February or March, we're going to be doing in DC what we call the government forum. And we bring lawmakers, senators, Congress people, AAM,
There you
and
go.
your members are all welcome to join us. And we basically give all of our corporate partners who join us at that forum a snapshot of where we are, what we're doing in the world, and how their support impacts our work. Our work, as I said, is changing a little bit. We are trying very hard to increase access to safe surgery wherever we work, so that regardless of whether a child needs their lip repaired or their palate, or they need a broken arm fixed, they can access a hospital that can actually take care of them. A hospital that has running water, a hospital that has, consistent power. Those are things we take very much for granted that are just not available in many, many parts of the world. But in addition, we recognize that it's not enough to just train the surgeon. The surgeon has to have somewhere to operate. So one of the tenets of our work, we call it a pillar of our work for the next 4 decades, is going to be health system strengthening. That's where our GIK, our pharmaceutical medical manufacturing partners, are so important, because they can help us. They can help us equip a hospital. They can help us identify biotechs who help us maintain equipment once we donate it, and really make those hospitals worthy of the people they exist to serve.
And so how do you identify these volunteers? And
They actually, in most cases, come to us. They hear of us and they want to work. Again, the surgeons I've spoken with on surgical programs, it's really, it affirms your faith in people when you hear from a doctor. There's a surgeon I had the pleasure of working with on a surgical mission. I'm not a doctor. I was just there along for the ride doing development things. He closes his practice for a week every time he goes into out of the country to provide free surgery. And he said it keeps him going. He has cosmetic surgery. He's a plastic surgeon. Many of our surgeons are plastics guys and women. And he shuts down. He gives his team the week off and he goes and does it. And he says it recharges him and really reminds him why he became a surgeon. And when you watch these surgeons in action, our co-founder, Dr. Bill McGee, says in every surgery, the surgery itself is only 10% the surgeon. The rest, the 90%, is everyone around that surgeon who makes that happen. And so when you go to one of our surgical programs, it's awe-inspiring when you see how many people, how much equipment gets shipped, how much it takes to do 15, 20, 100 surgeries over the course of a week or 10 days. And in addition, to think that all of those people are volunteering their time. A surgical program I went on, I met with a husband and wife who have a dental practice in Guatemala. And they shut their practice down every time they do a mission, and they've done 30 or 40. And that's the truth for many of our doctors. They do 30 or 40 missions in their lifetime or more, and they keep coming back for more, which I think is really inspiring.
But the surgery itself, once the team is there, a highly trained team, they're in country, 45 minutes, an hour.
Can take as little as 45 minutes. And
amazing. And change a child's life in 45 minutes.
Absolutely. Absolutely amazing. More complex surgeries. There's unilateral cleft, which means there's one hole in the child's lip. And then there's bilateral, which are much more serious. It's 2 holes. And oftentimes that's also accompanied by a cleft palate, which makes it, as you said at the beginning of this program, very hard for the child to eat. If a child can't eat, as soon as they're born, they're going to be in rough shape health-wise very quickly. So we work with companies that donate specially modulated bottles that allow parents to feed a baby until that cleft can be repaired. But yeah, it is. I think that's one of the things that impresses donors so much, is how little time and how little money. Because even though everything's donated, there still are costs. Costs are very real, and we raise money to offset those costs. But what is the cost of a 45-minute surgery? We say it's roughly $240.
You started to go into the expansion of your mission. Tell us a little bit more about that.
Yes. Well, when we were founded 40 years ago, we were very much a fly in, fly out kind of organization. right? It was often the Americans or the Northern European surgeons flying into a developing country and flying out. And over time, we realized the best thing we can do for the countries in which we work is to help strengthen their own medical systems. In other words, train physicians to stay there and do their own surgery and equip them with medical centers that can address all kinds of health needs, not just cleft lip and palate, but which can, address that as well. So as we look, we're about to celebrate our 40th anniversary in 2022. And as we look to the next decade, we really are putting a stake in the ground and making health system strengthening and increasing access to healthcare, two of the things that are going to influence everything we do, where we work, how we work, what we do when we're in country, what our teams are tasked with doing, although cleft, repair will always be at the forefront of our work.
I've seen the PSAs about Operation Smile for many years on television and seen the amazing before and after photos of children who've gone through the procedures.
Mm-hmm.
When you're part of a team that's gone in country, what's that like? You must have amazing personal stories from some of these children.
It's really moving. And it is, as I said, I liken it to a ballet, right? It's a lot of work that has to come together from a lot of different people, many of whom don't speak the same language. And in fact, one of the things that I found really, I just felt, so out of touch with things in the places we work when I was on a mission, and it was in Latin America, and a family came, and there was a lot of discussion the day of assessment. The initial day of every surgical program is assessments where teams of different doctors and medical professionals evaluate. So there's probably 5 or 6 stations so that we make sure we catch any health issue that a child might have that might preclude them from receiving surgery. So as this family was going through the assessments, it became apparent that they didn't speak Spanish. And I thought, well, what language do they speak? And someone said, oh, well, Kendra, there are so many indigenous languages that, where we were, that we can't possibly have translators for all of them, and no one speaks their language. And I just thought, wow, that's really remarkable, because I never would have thought that. But we're dealing with families who are often coming from such a distance and in very, very remote parts of different countries on every continent, that's just one of the barriers. The other barriers include transportation, include money to get there, include not being able to take time off of work or being fearful of losing your job. At the surgical program I went to most recently, we had families travel 13 to 17 hours on 4 different modes of transportation: buses, foot, motorbike, Uber. I mean, everything they could do to get that child to that surgical program, they do. And oftentimes they sell off cattle, they sell off furniture, they sell whatever they need to ensure that they have the money to travel. Now, when we can identify them and we have the means and vehicles to transport, we will. But oftentimes these families come from such remote areas and often mountainous areas, and we just don't have the means of helping them get there. We provide, whenever we can, food for those families to go back, recognizing that they took time off, or that maybe they don't have a job now because they decided to come to a surgical program and spend a week there, and now maybe they've lost their job. These are very real things for many people in many parts of the world. So we try to make it as easy as possible on families to get to surgical programs, to stay there. We put them up. We have to house families for, several nights. And that kind of shelter can look like anything from, a hotel to a makeshift tented area. It just depends on the country we're in. We feed them while they're there. So it is when you talk about what's it like on the ground, it is
Takes a village.
Controlled chaos, but
Right.
It is very, very well organized and planned. And there's something to do every minute. You come home after a surgical program and you are spent. You are tired. It's a good tired.
Is there a number after 40 years? Is there a ballpark number of how many surgeries have been performed by Operation Smile team?
Don't quote me, I think it's around 300,000.
Wow. Well, Kendra, thank you for spending some time with us today. We've been
Thank you. Thank you. It's been a pleasure.
delighted to have you with us, and also delighted Operation Smile is a part of the AAM family. And I would encourage all of our viewers to learn more about Operation Smile. Go to our website, accessiblemeds.org, and you can see them on the members portion of our website. You have a link. You must have a website, Kendra, you could send folks to directly.
Yes, www.operationsmile.org.
Well, thank you so much, and we'll see you next time on AAM's All Access.